Follow-up after your bariatric weight loss surgery.
On the ward after surgery. When you wake up, you will be wearing anti-embolic stockings. You will also have some intermittent pneumatic compression boots on, and these are boots that wrap around your calf and squeeze in and out gently to prevent blood clots. They will be removed by a nurse as you start to mobilise, and we encourage you to get up as soon as possible and as soon as comfortable to do so to prevent blood clots, chest infections, and also to help relieve that trapped gas pain. The nursing staff may also give you a Voltaren suppository in the evening before you go to sleep. This is a really good painkiller and it can help with discomfort, which will aid you to sleep better. You'll go home with 3 of these suppositories as it is just a short-term treatment. You'll be asked to sip fluid slowly before going home, and you may have some milk or very thin soup. Just aim to not take too much air in when swallowing. You'll be seen by the surgeon and other members of the bariatric team the next morning, who will review your wounds and discuss post-operative care and advice. Your wounds may be glued with a soluble stitch internally. Sometimes this stitch can protrude out slightly, but be assured it will dissolve, it just takes a little time. The wounds may also have clips in, which will need to be removed by your practice nurse in 10 to 14 days, and you will need to arrange this appointment. On the ward continued. You may find that the first time you pass urine, it could be green in colour, which is due to the surgeons using a blue dye to check during your surgery that there are no leaks. Early mobilisation will help prevent chest infections, muscle weakness, pressure sores, and blood clots. And this is why the nurse on the ward will be encouraging you to mobilise as soon as possible after surgery and when you're comfortable to do so. Practicing deep breathing exercises will also help to prevent chest infections. A combination of 3 to 5 deep breaths, then huffing 2 to 3 times, as if you were huffing and steaming up a bathroom mirror. If you need to cough, you can use a rolled up towel or pillow on your abdomen for comfort. The nursing staff will explain how to give your blood thinning injections to yourself, or if you've nominated a relative or friend, they will also be able to explain to them. You will have your bloods checked the next morning, and all being well, you will be discharged home. Medications provided on discharge. These are the medications that you will be sent home with, and a nurse on the ward will be able to explain to you about them before you go home. You'll be sent home with an anti-sickness medicine, and this will be in a liquid form, and it is usually metoclopramide, and this is to be taken if you're feeling nauseous. Pain relief, you'll be given tramadol or codeine, usually we give tramadol, and the Voltaren suppositories, which is also called diclofenac, and as I said before, there will be 3 of those. You will need to purchase your own paracetamol, which will need to be in a liquid or dissolvable form, as this will not be supplied. You will be given laxatives, and it's a mild laxative called lactulose, and you need to use this when required. If you are starting to experience loose stool, then to stop using it and only use it if you need it. You'll be given your blood thinning injections, and this is dalteparin, and it's for 2 weeks. You'll also have an antacid, which is lansoprazole, and this will protect your stomach, and it needs to be taken for a minimum of 6 months. This can change to another suitable medication like omeprazole or esomeprazole when you are able to have capsules or tablets.
Contraception and pregnancy after surgery. Bariatric surgery can often lead to improvement in fertility issues such as polycystic ovaries, and it is therefore important to consider contraception after surgery. Following weight loss surgery, it is crucial not to get pregnant within the first 12 to 18 months, but essentially up to 2 years, as this can cause nutritional deficiencies in both the mother and the fetus during this time due to the extreme weight loss following surgery. There can also be complications such as internal hernias following a gastric bypass, which is why we tend not to offer bypasses to women who have not yet had their families or of childbearing age. Following bariatric weight loss surgery, we know that the contraceptive pill is not effective and absorbed following a bypass, and we are not sure of how effective it is following the gastric sleeve. So therefore we would recommend other forms of contraception such as an IUD, which is the coil, injections, hormone implants, and if people do want to consider still taking the contraceptive pill with the sleeve, they would need to use other effective methods such as the barrier method, so using condoms, but ideally they should be using the injection, the implants or the coil. When to contact your team. If you are struggling with regurgitation, vomiting or excessive nausea and you're not able to keep anything down, including sips of fluid, and therefore you're liable to get dehydrated, please contact your team. If your pain is not settling, give us a call and we can talk to you about your pain relief and where your pain is. If you need advice regarding your bowels, if you're very constipated and the medication doesn't seem to be working, or you have diarrhea, please let us know. If you're feeling very tired, weak, or just not right in yourself. If you're struggling with introducing the next stages of the diet or having problems swallowing. If you're having problems swallowing, let us know. If you're struggling with introducing the next stage of your diet, we would always advise you to slow down and introduce the next stage slowly, but contact us if you need support with this. If you're experiencing high temperatures and shiver shakes, signs of sepsis, severe abdominal pain, we expect you to be sore, but you get a sudden onset of pain, bleeding from somewhere you shouldn't be bleeding, vomiting where you can't keep anything down, sudden shortness of breath, or pain, redness and swelling in your calf, which is an indication of a blood clot, then please attend your local A&E department. Do not leave a message on our answer machine, as we obviously may be busy and may not get back to you for a while. Post-operative follow-up. You will be seen on the ward prior to discharge by members of the bariatric team. On discharge home, you will be contacted at regular intervals over a 2-year period, and these will either be by telephone clinic, virtual video call clinic, or a face-to-face clinic with various team members prior to being discharged back to your GP at 2 years. You will be required to have bloods taken throughout this follow-up and by the hospital, and this will be obtained following your clinic appointment unless indicated on your documentation. So for example, some of the virtual calls you will be asked to attend the hospital prior to this appointment to get your bloods done. Your GP will not be required to take any additional bloods during this time with regards to your surgery. If you're having investigations for other complications or issues, or you normally have regular bloods taken for various conditions, these are to be carried out by your GP. Thank you for listening, and hopefully you found this useful.